All right, welcome back to ABA exam review and the continuation of our RBT practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. You're conducting a free operant preference assessment in the playroom. The client has access to 5 different toys. You observe that they spend 80% of the time with the train, 15% with blocks, and 5% with puzzles. What conclusion should you report to your supervising analyst? So let's think about what our goal is for a preference assessment. What are we ultimately trying to assess? Well, we're trying to assess what this client may like. With a preference assessment, we're not deciding what is and isn't reinforcing or what's going to change their behavior. We're looking for something that is potentially motivating due to the client's opinion about it. In other words, are they engaged with it? Do they want to engage with it? Maybe they'll work for it. And in this case, if the client has access to 5 toys and they're spending time with 3 toys, most with train, second with blocks, and 5 with puzzles, 5% with puzzles, what conclusion are you going to report from that preference assessment? A, all toys are equal reinforcers since they were available. Obviously not in this case, because we're doing a preference assessment, for one, where we're not determining reinforcers, and two, there was 5 toys and they only engaged with 3. B, trains are most preferred, blocks are moderately preferred, puzzles are low preference. That's a pretty good finding from this preference assessment, right? They spent the most time with trains, second most with blocks, third most with puzzles. You're not drawing too many big conclusions, you're just reporting what happened. That's a good report. C, trains are proven to be reinforcing. Well, no, just because they spent 80% of the time with the train, in order for something to be reinforcing, we have to see it actually changes behavior. We haven't done that yet. D, puzzles should be eliminated because they are a low preference. Well, to start, there's 5 toys and they engaged with 3, puzzles being one of those toys. And when you are doing a preference assessment, you really want to cast a wide net, because when we do a reinforcer assessment, we want as many possible reinforcers as possible. So if there was any engagement with the puzzles, we don't want to eliminate those. We want to potentially use those in our reinforcer assessment. So what you're going to conclude and report exactly what happened. Trains are most preferred, blocks are moderately, puzzles are low preference. While teaching laundry, you have the client place clothes into the washer independently, then you prompt them through the rest of the steps. Later, you add the next step, adding detergent, while still prompting the others. What teaching method is this? So let's think about this. You're teaching laundry, and you first have the client place clothes into the washer independently, and you prompt through the rest. So if we have placing clothes into the washer as first step, and then we're prompting through the rest till the end, what are we doing? Well, we're using some sort of task chain, obviously. And so now we have to decide, is it forward chaining, backward chaining, or total task chaining? Well, we know after you are prompting them, you add the next step, which is adding detergent and then going through the rest. And so we're starting from the beginning and going through each step from the start, which is going to make this A, forward chaining. Chaining should be pretty straightforward, right? We know with the task analysis, we are breaking down the behavior into steps. We're now going to use a chain to teach those steps. That chain can be forward, backward, or total task. Forward, we're going to start with that first step and go through. Backward, we're going to start with this last step, right? And then go back through. Total task, we're going to teach all steps, or really identify all steps and work on all steps and teach what needs to be taught. And so as long as you keep that in mind, these become fairly straightforward. Fading obviously is not our teaching method. It has nothing to do with the answer. What method is this? Is A, forward chaining. A parent says, "You're so good with my child. Can you stay after session and also help us with their chores around the house? They offer to pay you extra for your time." What is the most appropriate response? Now, in our field, right, according to our current ethics code, we're trying to avoid dual relationships. We're trying to avoid any conflicts. And you're always keeping personal and professional separate. Your role as an RBT is to work on the clock during your sessions and implement the plan you're given. You're not to go outside of that time or that designated role and start providing extra sessions or time with this family. Even if they're offering to pay you extra for your time, you're now creating a potential conflict of interest with this family given your duty as an RBT. If you come off the case as an RBT, things might change. But as long as you're working with the child as the RBT, you cannot stay after session to help with chores, even if they pay you extra for your time. So, what is your most appropriate response here? A, accept since you're still being paid for services. No, because you're creating a potential conflict of interest. It would be unethical. B, decline as this would be outside your role. Yes, it is not your role to stay after your session and help with chores, even if you are good with the child. C, agree as long as your supervisor knows. Well, your supervisor should be the one telling you to not do this and then having a discussion with the parent about why you shouldn't be doing this. And D, only agreed if you are not paid. Of course not. You're not going to work for free, and you're definitely not going to work for free with this client off the clock, because then it really is closer to a personal relationship than a business relationship. So the most appropriate response is going to be B, decline, as this would be outside your role. The client learns to use a PEX card for a cookie in the clinic. At home, the parent reports the child screams for cookies instead of using the card. What is the most likely issue? Now, there's an idea in ABA where we're looking for the simplest explanation first, and you want to try to do that on your exam. If you have a client who's using PEX in a clinic, but at home they don't use the card, instead they scream, what's the first thing we notice here? Well, they have a skill they can use in one setting, but not in another. It hasn't generalized. So what do we think the most likely issue is? A, the skill hasn't generalized to the home setting. Yes, and that is incredibly obvious, but many of our answers are obvious. We're looking for that simple explanation. Skill has not generalized yet to the home. That's a problem. B, the child screaming is on extinction at home. Well, if they're screaming for cookies instead of using the card, there's no indication that the parent is actually putting that behavior on extinction. C, the parent is using error correction incorrectly. It doesn't describe how the parent is using any sort of feedback or correction. And D, PEX cards don't work outside structured environments. That's just not really relevant here. If the PEX card is working in the clinic, it just hasn't generalized to the home. There's no reason it can't. So what is the most likely issue? The skill has not generalized to the home setting. The behavior analyst writes a plan where you provide reinforcement every 2 minutes if the client has not engaged in yelling. The client still engages in other minor disruptive behaviors like tapping and fidgeting. What type of procedure are you implementing? And you'll notice we're using the acronyms here, and I want you to get used to reading both the full terms and also the acronyms, right? And we want to be comfortable with this. So DRs are differential reinforcement. We have alternative, we have incompatible, we have other, and then NCR is going to be non-contingent reinforcement. So if you have a plan where you give reinforcement every 2 minutes, if the client has not engaged in yelling, what type of procedure are you implementing? Well, remember our differential reinforcement procedures. If we're reinforcing for a behavior not happening, so the client not engaging in yelling, we are differentially reinforcing other behaviors. If we're teaching a replacement behavior, we're going to be using an alternative or incompatible. But in this case, reinforcement is coming if the client is not engaging in yelling. They're still engaging in other destructive behaviors. We're not teaching them a replacement. We're just trying to reduce the amount of yelling. And we're doing that with a DRO procedure. Thanks for watching. Check out btexamreview.com for all our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.